Good evening and welcome back to Living with COVID-19. I'm your host, Andrea Pitts, and I thank you for joining us again. Viewers, 2021 has been a little kinder to us on the health front so far. We have seen that the reported cases of COVID-19 continues to dwindle, and so too have the associated deaths. Gyms have been allowed to reopen. Restaurants are now allowed to operate with more flexibility. And truly, in a sense, it can be said that we are being rewarded for our months and months of rigid sacrifices that have allowed us to enjoy the successes that we are experiencing right now. So, good job, everyone. But we must still await that elusive point where we can say the world has ridded itself of COVID-19. For that to be possible, it is very important that we all continue to maintain our vigilance and best practices, because we have heard that those who have encountered COVID-19, they all say it is no joke. Well, most of them say so, the ones who actually have experienced symptoms. And in terms of the vaccine, we have seen that some Caribbean nations have already begun to receive their shipments of the vaccine, and Belize is supposed to do so shortly as well. So we have more and more people speaking of the vaccines at home, at work, and on the news. And so we believe that it is important for you to know how vaccines actually work and what it will take for us to finally be COVID-19 free. So we ask you to take a look at this short video from the Yale School of Medicine that explains how vaccines work.
The immune system protects us from infections with a wide variety of pathogens.
When we are infected with viruses, we engage multiple different layers of defense system, sort of like an orchestra, and different types of effector functions are associated with the immune response. It's almost like different instruments.
What vaccines do, they basically mimic viral infection. That is, they provide the blueprint to the immune system so it can react quickly and efficiently, preventing us from getting sick.
It's like a sheet music for the orchestra. We're telling the immune system what to do and how to do it to trigger a response that's almost equivalent to having had an infection, but actually can be even superior to that.
In the case of coronavirus, it's the simplest type of response that just prevents the virus from entering our cells. And these tend to be extremely safe. All you need is to induce protective response that is based on proteins that the immune system makes, which are called antibodies, and they bind to the virus and prevent it from entering our cells.
Normally, vaccine development takes years to decades. From inception to implementation. However, because of this pandemic, every step is being expedited.
There are several trials that are performed before vaccine can be used to make sure that vaccine is safe and that it provides protection, that is, that it's effective.
It is akin to the rehearsal phase of that orchestra before opening it up to the public. And that is really important because during that rehearsal stage, you might find an instrument that's missing or that's not working, or a practice that's needed in this area versus that area. And that can be all tweaked within the phase 3 trial.
Some people cannot be vaccinated because they have, for example, some underlying illness or defects in the immune system, or they may be too old or too young. Those people are vulnerable to infection because they cannot be protected by vaccination themselves. But they can be protected by healthy people who are immune, and therefore they prevent the spread of the virus. And that's what's called herd immunity.
We need to ultimately have herd immunity to stop the spread of this virus. And it's really important to remember that before a vaccine is approved, it undergoes rigorous amount of testing for safety and efficacy. So once a vaccine is made to be publicly available, we should be lining up to get those vaccines.
I believe that was very informative and even entertaining. We saw that becoming COVID-19 free depends on the term herd immunity, which is something Dr. Manza told us about last week. Herd immunity will require that almost everyone get vaccinated. So it will be very important that the vaccine is distributed equitably and efficiently across the world for us all reap its greatest benefits. Viewers, living with COVID-19 will take our first ad break now for the evening, but we will be back shortly for a chat with one of our doctors on the front line. So kindly stay tuned. Good night once again and welcome back to Living with COVID-19. I'm your host, Andre Pitts. Medical frontline personnel in Belize are on high demand right now, and that is actually an understatement. Many of them are working 24-hour shifts, administering care to the many people admitted in hospitals and the many that show up for emergency care. One of those medical professionals on high demand right now is Dr. Elaine Gonzalez, who is joining us now. Welcome to the show, Dr. Gonzalez.
Thank you, Andre. I'm glad to be here on the show.
We're glad to have you. How are you doing today, Doc? And first of all, would love to thank you for giving us some of your time on one of your few days off from work.
Yeah, well, I'm doing good. I'm resting up, taking it easy, because when you're grinding, when you're working, right?
Okay. How often do you get days off?
Our schedule is set up like we work 2 days, then rest 3.
Okay.
Work then rest 2, or work 3, then rest 2. So we get like 3 days off within our work days.
Okay. And when you're working, it's mostly 12-hour shifts, 24-hour shifts?
Well, what we do right now, we work 12-hour shift in the hospital and in the COVID unit as well.
Okay. Well, Doc, kindly introduce yourself to our viewers and tell them a bit about what you do, where you work, and your direct responsibilities as it relates to COVID-19 patients.
So perfect. So I'm Dr. Elaine Gonzalez. I have been working at the KHMH for the last 13 years, and I've worked in different ward in the KHMH. And right now, I'm presently working in the COVID unit at the KHMH. When I say COVID unit, I refer to the whole COVID area. The COVID area is divided into two, the COVID unit and the PUI area.
Okay. And how large are those units? Are they just a small wing of the hospital? How exactly is it set up, and how many people can be accommodated in the entire COVID-19 unit?
Right. So right now, we had to do many changes to the hospital. Of course, KHMH, they have the emergency area, and we have the outpatient area. So the entire emergency area had to be revamped, had to be changed over to the COVID unit, because we did initially have a small COVID unit area, but we noticed that we were starting to spill over. Yeah. And because we were spilling over, we had to take the whole emergency area that was first emergency and change it to a whole COVID unit. So as I mentioned before, the COVID area is divided into both COVID area for positive patients and a PUI area, which is patients under investigation.
Okay.
So if you come with symptoms of COVID, they will put you in the PUI. If you come with COVID already positive, then they put you into the COVID unit area.
Okay. Doc, and I think right now there's still a little bit of gray area and confusion, and some of it driven by fear, where people don't exactly know when or if they should go to a hospital to seek medical care for suspected COVID ailment. So who exactly are the patients or people that should go to a medical center or a hospital?
That's a very good question, Andre. A lot of people sometimes tend to come to the hospital for every little symptoms, right? Which is not wrong, because as the government have been saying, that you need to go and get checked up once you think you have one of the symptoms. And again, the symptoms can vary now. We notice that with the onset of this COVID, the symptoms can be from cough, cold, fever, and then we have the famous ones like the loss of scent, loss of smell.
It's just a broad range of symptoms.
It's a wide range of symptoms. And we have even seen some people that have gastrointestinal symptoms as well. So if you have some of these symptoms, but specifically like the fever, then we want to encourage you to go to your health center, your nearest health center, to be tested, right? You don't necessarily have to come to the hospital, but you can go to the health center to be tested. And while you're at the health center, then they will determine if you need to be transferred to KHMH or to maybe our next regional hospital, right? Okay. Now, if you are already positive and you're at home, and if you know that you have COVID and you realize that your symptoms starts to get worse, maybe you have higher fever, maybe the fever is not going away, maybe
you can't breathe good.
Maybe you can't breathe, your breathing is getting worse, then I would advise you to reach to your health center, to the hospital as quick as possible. That's not the time you need to go to the health center. You need to go straight to one of the regional hospital or KHMH, because then you will need to be hospitalized and be treated in a hospital facility at that time.
And another demographic, I think, in general, that may have some difficulty going to seek medical care is men. Men typically resist going to health centers. Do you find that this is the case, and how does that translate in the type of, in the number of men who end up being intubated by the time they seek medical care?
To be honest, Andrew, we have had patients who have come to the hospital, and at the point when they have come to the hospital, it's because the only thing that we can do for them at that time is intubate them.
Can they come too late?
Yeah, because they come very late. Okay. I don't want to, but I have maybe like 2 cases I can refer to when I was working in a COVID unit the first time, because this is the second time I'm working in a COVID unit. Okay. We now working there at a month times, no? So we would work in a month, they would take us out, and they rotate us, and then we go back in like a couple weeks, months after for next month. Okay. And so this is my second time doing a month in the COVID unit. And I remember in the first time I was in there, we actually had a man who came in, but because he didn't want to come to the hospital before, right, and he waited until the last minute, when he reached the hospital, we actually was about, the only thing we could have done for him at that time was intubate him. And the man passed away maybe like 3 or 4 hours after we intubated him, because he was too far gone already. Yeah. So men tend to wait a while. Females are more cautious. They get sick, they want to go and check up better, fast than men.
They're so more proactive.
To reach out to the hospital. Don't be afraid. Listen to the advice of your family, because sometimes the family they call the hospital and they say, you know what, my husband have this or my son have this, and they wonder if they should go to the hospital. And by the time they reach critical. So if you see that time is coming upon you, that you get more shortness and more fever, you need to come to the hospital.
Yeah, being proactive is key when it comes to this this disease. But
right.
You were mentioning a bit about the shift system in this COVID-19 unit. And so in general, I'm curious to know what have been your experiences so far in the COVID-19 unit. And if you could share a bit about some of the challenges of working in such a demanding and I suspect a tense unit.
Right. Yeah. First, I want to say thank you to all the nurses, to the doctors. But people sometimes think it's only nurses and doctors who work in the COVID unit, but it's not that way. We have everybody who works in the hospital at some point or the other works in the COVID unit. And we have the domestic that works in the COVID unit. We have the PCS that works in the COVID unit. We have the attendant that works in the COVID unit. We have the guys who do x-rays that goes into the COVID unit to work as well, to do x-rays of patients in the COVID unit. Because once a patient is in the COVID unit, we don't take them out of the COVID unit. So if they need an ultrasound, if they need an x-ray, whatever they need, we have to go in there to the unit to actually do it for them. So the people from the kitchen staff who provide the food and who take it to the COVID unit as well, I just want to say a big thank you. And we have been working this way for the last maybe 6 to 8 months from the beginning of the year, around we had our first case. And we have had many, many challenges. Like I said, we had to actually change the area and make it much bigger. When it comes to experiences, man, I can remember my first time putting on a PPE and walking into the unit, you had to get adapted to using the PPE because the PPE can be very hot, you know? And so you have to be adapted to using the PPE. And beside that, we use goggles.
And the PPE, sorry, before you move on, it's a full body suit, correct?
It's a full body suit. Yeah.
Okay.
It's a complete thing. So, yeah, it's long sleeve, long pants, you have the boots. Then when you use the PPE, you have to wear 3 gloves, you know, for protection. And so you have to wear your N95 mask, you have to wear your goggles, and sometimes you can wear a face shield. But one of the things that is very challenging in the unit, and a lot of people will tell you this works in the unit, is sometimes the goggles tend to get very foggy. And you could be in the unit and you're not seeing properly because there's so much fog in the goggles.
And you can't work if you can't see.
You can't work if you can't see. But we have a little trick for that. You know, you have to actually put soap inside the goggles properly and outside. So when you breathe in, the fog doesn't affect you. It doesn't build up on the goggles itself.
Sounds like a snorkeling trick.
Yeah, like a snorkeling trick. So I mean, working in there, by now we have learned to adapt. Working in there, like I said, we work as a team, right? Sometimes there might be just a nurse and a PCA in there, or might be just a PCA, right? And a doctor. And so, you know, roles might have to change sometimes because we might have to feed patients, empty urine, you know, we might have to help out because the PPEs, believe it or not, each PPE costs about $200 billion, right?
Wow.
We don't use the PPEs for the entire 12 hours that we're in there. When we go in, we put on a PPE maybe for like 3 or 4 hours that we're actually in the area with the patient, and then we come out. But we're not in and out, in and out, in and out because we don't want to use too much PPE.
And they're not recyclable.
PPEs. No, once the PPEs are off, that's it.
Okay.
That we use in there are recyclable, except for the goggles because the goggles, they can wash them and sterilize them.
Okay.
PPEs, we take them off, it goes into a red container, and then that goes to burning, you know, it goes to get rid of it, right?
Okay.
And same thing with the mask, the gloves, everything else, you know, everything else is destroyed after that, right?
Okay.
Goes to the furnace.
And so you've shared what it's like for the medical professionals. Can you tell us what it's like for the patients? Do you find a lot of patients in there in desperation, or do you find some in high spirits who try to pass that on to other patients who are not doing as well?
Right. We have had a range of different patients in the COVID unit. Let me just stress on this again. When the whole area is considered the COVID area, COVID area is divided into 2 areas. It's divided into what we call the COVID unit for positive patient, and into the PUI unit, which is patients under investigation.
Okay.
Go into the hospital, they do a rapid test on you, but you're waiting in a certain area, right? If the rapid test come out positive, then they will also do a PCR test to confirm, right? So you will have to wait a bit longer, maybe like 2 or 3 days.
Okay.
So they have some patients who are already hospitalized, right? They have COVID, but they don't have severe symptoms of COVID. Maybe they come because they couldn't probably breathe properly, or they had a high fever. And so while you're in there, you're still allowed to use your cell phone. We don't restrict you from using your cell phone.
Okay.
So many people will continue to communicate with their families, loved ones outside, you know. And then for the more severe patients, those are the ones who are intubated. Those are the ones who cannot communicate. And in that sense, we have adopted now in the hospital using tablets. So we have special tablets in the hospital that a doctor, a nurse, or again a PC or attendant would hold the tablet close to the patient's face, and then the family member outside
the family
on the tablet, right? And then so they can communicate with the patient directly using that tablet. Many times, you know, you can see little reactions from the patient themselves, you know, because while you're intubated, while you're sleeping or medically induced
coma.
Yeah, induced coma, you can still hear, right?
Okay.
So many times the family members can talk to you, and the patient that is in there can still hear what the family members is saying, you know. And you might see a little tear come out here and there, you know. You might see a little heart rate increase, something like that, you know, to know that the communication is still there, you know.
Okay. So family members are getting through to their loved ones.
Right, even though they're lonely in there, nobody can go in there and hold their hands or hug them up or kiss them. You know, you still have a little communication via the tablets that we use in the hospital, right?
That's excellent, Doc. And it's just one other instance of how technology has been used in this time as a bridge to help make things better for people.
Right, very true. Because I mean, many times, no patients, families are allowed to go into the COVID unit, right? Because of course you don't want to infect someone else. Yeah. So what they would do, they would maybe call from home, right? And we use a tablet to just communicate with them, or maybe call from wherever they are, right? They can be in the comfort of their home, and they can call to the hospital, and we connect them through the tablet once we're in there with the patient. Okay. And the patient, you know, hear them from the voice.
Okay. Well, you just increase our appreciation for medical frontline workers. You say, when they administer care, you feed the patients, you empty their urinal trays, and you even hold up tablets so that their loved ones can communicate with them. So that just adds our appreciation for all that you guys have been doing, Doc.
It's a big team effort, Andre, because like I said, when we started off, maybe like 8 months ago, it wasn't like that. But as time have passed by or gone, we have adapted to a lot of different things, you know, to a lot of different changes. Yeah. And trying to make the patients in there more comfortable, because we realize that, you know what, when you're in there, it's because something really medically wrong with you, you know, you can't breathe. And at any time, your condition can get worse. You know, you are given medication around the clock, you're on oxygen around the clock. And for the ones who are on the ventilator in coma, you know, we try to make it as comfortable as possible for you while you're in the unit, you know?
Yeah. Well, Doc, unfortunately, we're just about out of time for our interview. But before you leave, I just want to get one message from you for our viewing or listening audience. Because while our COVID-19 numbers are declining and maybe we get back more freedoms, I'm pretty sure that there will be some people who will start let down their guards. So, especially to that population, what message do you have for them?
Well, Andre, that's I have a big message for people who want to let down their guard, you know. If you have been watching the news and you've been up to date with what's been happening recently with COVID-19, you will notice that there are new variants, you know, of the same COVID virus. We know that there's a UK variant, you know, and they've been developing different strains of the same COVID virus in different other places, and it's actually in the US now. And it's slowly trickling down to Mexico. And I know at some point or the other, it might come to Belize. I am happy that right now our numbers is very low. You know, we have numbers, I think today's number was 18. And we have been having very, very low number, 20s, in the 20s, you know, 30s, as compared to maybe 6 months ago when we had
hundreds,
400, 500. It was ridiculous, right, at one point. But I'm happy that our people are adhering to the guidelines set forth by the ministry, right? Which includes the social distancing, you know, the physical distance of 6 feet, you know, wear your mask, the hand washing. You know, I still go out to many different places when I'm not in the COVID unit, and you still have to wash your hands when you go into maybe to the supermarket or somewhere. You have to wash your hand, you have to sanitize, you know. You go to buy meat at the meat shop, you have to continue sanitizing your hand. So I want to tell the public, don't stop doing these following these guidelines. These guidelines are very, very important, you know, because this is what is going to overcome this COVID-19, right? Of course, within the next 3 to 4 months, we should be getting the vaccine. And maybe after the majority of our population have been vaccinated, right? And I want to encourage you as well that if the vaccine comes, to get vaccinated, right? Because it has been proven that it helps to decrease the spread of the COVID-19.
True herd immunity, so to speak.
Right, correct, herd immunity. So again, guys, continue with the guidelines. Don't let your guard down. I'm happy that the government still has certain restrictions in place. I know sometime or the other they might ease up on some of the restrictions, but that doesn't mean that we have to be out there, trying to spread the virus or spreading the virus, because again, this virus doesn't spread on its own. It is us who spread the virus. We have to walk from one spot to the other, or from point A to point B to spread the virus. It won't go by itself. So just adhere to the guidelines, guys, and let's see how we can beat this COVID-19.
Excellent messages there, Doc. And I'd love to thank you for taking the time out to join us tonight. And of course, I want to encourage you to try to enjoy the remainder of your days off before you get back to the grind.
Definitely, Andrew. Thank you, man.
No problem at all. And before you go, I hope you could commit to joining us again sometime soon, because we enjoyed this conversation.
Definitely, man. Maybe one of these days we could do a COVID unit, COVID live, from the actual COVID unit.
That would be excellent. You tell us when, and we'll definitely do that.
Sure, man.
Excellent. Enjoy the rest of your night.
All right, same to you, Andre.
Thanks.
Take care.
Well, viewers, you heard just now, that was Dr. Alain Gonzalez from the KHMH here in Belize City. And as he was sharing with us, working in the unit has its own challenges and complications, but our medical frontline personnel are up to the task. And of course, we heard that many of the COVID-19 patients who seek medical attention, that is, have severe symptoms, and many of them require round-the-clock care to make it out alive. But thankfully, our hospitals have committed and dedicated personnel there working together as teams to help our patients through. And although resources are spread thin and the numbers fluctuate, our actions are not up to par. But thankfully, our heroes on the front line are always there to provide due care. And for that, we express the heartiest thank you possible. With that said, we are finished for our show for tonight, but please remember, Living with COVID-19 airs Mondays at 7 p.m. right here on CBTV and on our Facebook page, Colorblind Multimedia Productions. We look forward to having you back with us next week. But until then, please remember to stay safe, stay informed, and stay healthy. Thanks for joining us, and good night.